Welcome to the Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. It's just me and Dr. Weiler here today. Tay's on vacation.
I feel like I've been gone forever, though. I do.
You have.
I think I missed the last taping, right?
You did?
I think there's just been one, though. Or no?
No, it was just one. It was one because we did it was the girl episode. The girls took over the consult.
We don't care.
After I had to sit through the boy consult, the bro episode that we did. We did a full on female episode. We had we had quite a girl party. We did talk about
that bromance. He's going to fly down and take me out to dinner. He is.
I don't doubt it.
He is.
All.
It's already scheduled in August.
But also, I would
can't wait for it, Michael.
I would prefer to go to him. I'd prefer to go to him.
Yeah, he is a much better, much nicer environment.
Because I'm like, his environment absolutely is better than us. I know you missed it. Like we talked about. Speaking of better environments, we talked about. We've all been bebopping in and out of vacation.
Yep.
At this time, you just got back. I just got back. Taylor's on vacation.
Yeah, I know. Problem is, I stack. You know, I feel like summer's gotten so short for kids these years. I mean, I don't feel bad for them, trust me, but it's like you literally have about 7 weeks if you and it's less if your kid participates in some type of activity or sport, right? Mm-hmm. You've got about a 3 to 4 week window, and I packaged 2 vacations into like 3 weeks, and it was like just my whole life got upturned. It was amazing.
It was amazing.
It was amazing to get away, but it's really, you know, I feel like it's tough with kids, especially, you know, it's not easier with little kids. I think it's physically harder, right? But you can't get away when they get older because they have like lives, right?
Yeah.
Dad, you can't go. That's when I have to do. You know, like tomorrow we're coming up in the holidays on the 4th, right? My daughter already has 48 hours of activities like laid out.
No, just stop. Just lay down.
I mean, outfits picked out, barbecue she's going to. She's going to go watch the fireworks over the river somewhere. And I have no plans.
No. No. I have zero plan. A friend of mine called me and was like, "Hey, do y'all want to get together? Do y'all want to get together for the 4th?" And I was like,
yeah.
I mean, yeah, but like, can it be late in the afternoon? Like, how about we do it late in the afternoon? But I mean, I feel like traveling. But you do the same thing. So Josh and I did it this year. We did like the adult trip, and then we have our family trip coming up in a couple weeks.
That's awesome. How was y'all's adult trip?
The adult trip was absolutely Turks and Caicos, if you ever have the chance to go, is the most beautiful beaches and water I have ever seen in my entire life. It was absolutely amazing.
Did Josh test out my son? Because I know they're all bigger men, offensive linemen, but did he test out my salt theory? Did he try to float? There's supposedly high. It's not quite like Dead Sea salt content, but it's a higher salt content in the Turks.
Right outside of
a large man should be able to float
in that water,
like a little woman.
Well, that's so. Right outside of where we were staying, there was this enormous coral reef, and so we were going we'd go snorkeling each day. And what was so funny is like you would just see all the bodies just floating in the water that were snorkeling all around the reef. We saw a sea turtle.
Oh yeah.
We saw a barracuda 100% straight out of Finding Nemo. Yeah. The barracuda was sitting on the edge of the reef, and it was like this long, and it was really silver. I got very scared. Josh was like, "You do understand that it cannot eat you," and I was like, "It could. It could.
That's a bull. It could bite you.
Something could happen.
It could bite you."
But no, I mean, I was so.
It's amazing.
I mean, it was
beautiful.
The most.
It's like a picturesque,
very postcard.
Yeah, postcard is beautiful white sand, beautiful clear water. It really is.
And you went to a volcano.
We went to a volcano. So I was telling people that I was going to Dominica, but I was quickly corrected as soon as I got on the plane, which was a very small plane, flying 4 hours almost.
Dominica, because it's not like the Dominican Republic.
Correct.
It's like the island
It's the island of Dominica. And it's kind of funny because it's a small island, pretty fairly undeveloped, kind of forgotten almost. They just recently started having flights. The airport runway is very short, by the way. And
That's a concern for me.
So they filmed one of the Pirates of Caribbean there, okay? Because it's so beautiful. It's a volcanic island. They have all these like crazy waterfalls, crazy cliffs. It's called the Nature Island, right? And probably a little bit too nature for me.
I was
a lot of hiking, we really just hung out and chilled. But it's funny because they bring you in and they incessantly talk about Captain Jack Sparrow. I mean, like, like, let me tell you something.
That's their claim to fame.
Everybody on the island talks about this man, Johnny Depp. And I do not know Johnny Depp. I like Johnny Depp. I think it was a very interesting sort of back and forth.
I love Johnny Depp.
I love
But
Johnny if he knew, it would be like a movie. He would be like a god if he went back there. I mean, they would literally like put him on one of those things they carry people around on. I mean, it's
probably a little too nature for him too.
1/4 of the movie there, and it's like it was filmed over 15 years ago.
Yeah,
and
it was early 2000s.
They still have the sets up. They still bring you. This is where Captain Jack jumped through. This is where he escaped. This is where his team was floating. I'm like, I kind of remember the movie. It's a good movie, but like, and it's also, so I think they filmed it there because it's one of the few, it's the only Caribbean island that still has its native indigenous population present.
Really?
So it's the one, I don't know if you've ever seen those movies, but like they're in these like bone round cages and they're swinging back and forth.
Yeah.
And then, like he's running on the beach from all these cannibals, right? And so those people live on that island, which is nowhere else in the Caribbean, and they're native. So they have about a 6,000 acre preserve, and they live as they did in not quite prehistoric times, but way.
Oh wow!
Yeah, so it's a weird place. It's a really cool.
That's
place.
what, and they're trying to like bring tourists and stuff. Did you stay in a hotel?
Yeah, we stayed in a hotel.
Okay.
Yeah, we stayed in this place. It was like up on a cliff, and I mean, I swear we had hurricanes the first 2 nights. I mean, it was like 40 to 70 mile per hour winds at times. Like,
no, I don't really feel like you have the structure here.
It was fun. It was fun, but it was. I'm gonna tell you something. Johnny Depp, if you're listening, return to the island of Dominica. You will be worshipped like a god.
You are a god.
You are a god there. It was.
But also, since
funny.
we brought this up, like, could you bring us? Because I would like to go too.
Yeah,
I would like to go.
Yes, Johnny,
I would like
us.
to go as well.
He's very extravagant. He likes to invite friends.
I'll be his friend.
I'll be his friend.
I'll be his friend. Are y'all doing a family trip?
We did. We went to Panama City Beach.
Oh, that's right. That's
right. For the dance competition. It was nice. It was nice. I really enjoy. It's such a beautiful place. I believe it needs to be rebranded. Into
You say Panama City Beach, and all I can think about, all I can associate it with, anything at all is the Strip and Club La Vila. So our expert that we're going to bring in, her name is Lacey May, and I know for a fact she has been to Club La Vila before in her life.
We're going to ask her about her Club La Vila experience.
I know she's been to Club La Vila. I know she's probably been a part of a foam party in Club La Vila.
Yes. Did she get in the water in the pool? There was a pool.
That's
Club
it.
La
there
Vila?
was a pool. Remember MTV?
From Club La Vila.
Spring break. Yeah. Oh,
I mean, look, Panama City Beach, it is a beautiful beach. It is crazy because 30A, which is like,
your watercolor water
the
set,
hoity-toity, multi-million dollars. Like you can literally buy an island for the cost of a house in 30A, right? And Panama City Beach, in my opinion, the beaches are more beautiful because it's a little bit further away from the Mississippi River. But it's just, it's the OC, right?
Yeah.
Been around since the 50s and 60s, and it's a beautiful place, but very touristy, got a bad rap. Got sort of branded with Club La Vila.
Every Club La Vila was
but it was
amazing.
beautiful. It really had beautiful weather. It really, I love the beach.
That's it. The reason that we took the kids to Mexico because it's cheaper to fly our family to Mexico and stay in Mexico in an all-inclusive resort, and they got to do everything they wanted because it's cheaper than going to the Panhandle, which is insane.
Isn't that crazy?
That's insane.
It really is, and I couldn't agree. I mean, it's cheaper to go to Mexico or the Caribbean than it is to go to Destin, which is crazy.
It's insane.
I always had a friend, so I'm not a huge Disney fanatic, but we've gone a few times, and he was a real yacht from New Orleans, and he'd be like, "Brah, why are you going to Disney? You can go to Paris for a week and a half for the same cost. And he's right. I mean, it's crazy.
I don't know who this man is, but he is apparently I will never forget. We were sitting in Paris in Epcot because we finally took our kids to Disney for the first time last year. And they were like, oh, Paris, like, but this isn't like the real Paris. I was like, no, it's not like the real Paris. I was like, but I want to let you know right here and right now, we could go to the real Paris for the same price that we paid to come to this swamp in South Florida. I'm just saying.
I love Disney, but damn. Paris and damn is Disney expensive. So.
That's right. Oh man. So that's all of our vacation catch up for this week. No, so we are actually going to, like I said,
what are we talking about today?
I was about to say we have our I call her my peptide princess, Lacey,
the peptide
princess that is going to come and talk to us today, and we're going to get her expert opinion. But everywhere right now in the media, on social. The talk, this is the thing, peptides.
Peptides are huge.
You hear this word peptide more and more every day. This word is being used. I had a friend of mine text me last night because we were running the promotion things for the hottest week of the year. And he was like, oh, you're over at Rejuvime? I said, yeah, I have an appointment in the morning. I want to talk to the nurse practitioner about peptides. Peptides. What are these peptides for? I was in a pool in Turks and Caicos. One of the people that we were with were like, hey, I just ordered a bunch of peptides. Isn't that what y'all do? I'm like, yes. It's like this word is catching on. Everybody's starting to look into these things. And there's a vast array of peptides.
So my opinion, and we'll ask Lacey, who's now been crowned the peptide princess.
Peptide princess.
So my opinion of this is that, I think we are in a time of amazing advancements in medicine, right? I mean, I think that, AI is on us. AI is going to push the envelope of development. Peptides, in my small mind, I think are really going to become a star of the show very soon. And so, I think with the changing environment of the FDA regulations, I think with Kennedy in there, whether you love him, whether you hate him, the envelope is going to be opened up a little bit more. I think people are educating themselves a lot more, especially people that are in the wellness, into the anti-aging, and into them really taking control of their own medical fate. And so people are educating themselves more. There's a lot more out there. It's easier to find. Peptides there's a lot of information out there. They're everywhere. They are a difficult subject because there's so many of them. They are not necessarily called something. They have numbers and names,
it's like
weird
I'm
things.
gonna like A47623. That's what I'm taking this week. And it's like I think
it's like a Pixar movie.
That's what, and I think people get nervous like when
they
hear stuff like that. It's like, well, wait a minute,
and I think they offer things that traditional medicine is more about cancer, or hey, I broke a bone, or
reactive medicine
and medicine that is very, very specific because it has to be FDA approved. It has to be approved by your insurance company. It has to be, all the physicians need to get on board.
And this is my conspiracy
theory. No, I'm with you. I'm with you. It's
let's hush the peptides because if people get too preventative with their health,
we don't need medicine,
need the other stuff. Yeah.
I mean, there's if you look online, you read always. I watch a lot of podcasts. You watch, there's predictions that hey, with AI, we may beat cancer in 10 years. So there is some amazing stuff going on. But let's get back to peptides. So peptides to me is something that is a little bit outside the scope of the FDA. There's a lot of peptides out there. There's a lot of great information. There's a lot of great peptides out there. You have to really, if you're going to get into peptides, make sure you have a strong relationship with your provider. Make sure you've got a very legitimate, don't go online and order peptides from China, please.
No, don't order any. Don't
order anything. Well, don't order food. Don't order anything. You can order clothes from Temu, which is China, but don't order anything that goes into your body, whether it's food, drink, or medicine.
I mean, look, I'm kind of I know this is going to sound awful, but I'm kind of skeptical of getting medication. Maybe it's just me. Maybe it's me. Maybe it's my generation. But I want to go and physically. I want to see you. I want you to see me. I want you to
I want to be
prescribe.
face to face. I want to be able to reach out and touch this person if I need to, that is prescribing the medication for me.
Yeah.
I want, and I think that's hugely important in medicine. And it's hugely important when you're talking about peptides, when you're talking about hormones, when you're talking about even the GLP-1s. I think it's, and I'm not, obviously we're associated and we're sponsored by Rejuvime, but I think just from a medical standpoint, we're getting into a time, and I talked about AI, where you can't even know what's real or not in videos on YouTube anymore.
At all. At all. And looking at like the side by side compare, like it's just crazy. But yeah, I think it's because we're older.
Well, and I think
older. And I think that
you're talking about
like just like the being in the scene and getting somebody from something. And
I think when it comes down to medicine. So did you know, if you look statistically, the number 3 source of income for the cartel?
Cancer drug, testosterone or cancer drugs, one of them. Maybe the
Both
number one.
Both of them combined, yeah. They will steal the packaging of cancer drugs.
Yes.
And they will fill it with sugar pills, and they'll put it back into the pipeline. Testosterone can be easily made in someone's kitchen with just olive oils. Mm-hmm. And there's a great National Geographic series of specials about the cartel's involvement in illicit hormones and cancer drugs, because hormones, because you can fake them pretty easy, and you can get them in the pipeline pretty easy, and then cancer drugs because there's so much money. I mean, some of these medications, hundreds of thousands of dollars per injection.
I can't
imagine. There's so much money involved in it. It really is crazy. So, to me, it's important that you can reach out and touch your provider.
You know where you're getting it from.
You know where you're getting it from. You know it's legit. And that goes that goes for cancer treatments. It goes for hormone treatments. It goes for peptide treatments.
Anything. There's
an average. I watch a lot of CNBC, which is a business channel. I know this is crazy, so I'm getting on a tangent here. But I also listen to the radio on it a lot. And there's an advertisement on there for a stem cell facility. There is a South American, I'm not going to name it, but there is a South American island that specifically became an international haven for experimental medicines. And there is advertisement on CNBC about stem cell therapy. And there's a man, Brian, I think his name's Brian Johnson. He's worth $200 million. He's trying to age backwards. I don't know if you've seen him on YouTube.
No.
Very, very smart individual. He went down there, and he's a YouTuber, films it. We'd love to get him on the podcast. And he went down there and actually got stem cell therapy. And he was kind of unimpressed, but they advertised it. So obviously he's a very intelligent man. He's pushing the envelope. But yeah, I'm getting off on a tangent, but
I went. It's so funny that you talk about getting off on a tangent. I was literally getting my hair done yesterday, and I was trying to explain to the girl that was cutting my hair. I was like, "Do you know how much money it takes to get something approved by the FDA?" I was like, "A breast implant, if you will."
Yeah.
I was like, "It just I'm like, listen to this." I was like, and guess what? It's been in all other countries for like all the. I was like, I went on a tangent about it yesterday.
So I think peptides, and to segue, peptides. Yeah. Amazing medication class. Mm-hmm. It is a controversial medication class. We'll talk about that.
It is.
But I think it can have amazing, wonderful benefits. And today we're going to focus on BPC, right?
157. So BPC-157, it's actually derived from Lilo and Stitch. No, I'm just kidding. No, BPC-157. I like BPC-157, and I actually have a patient that I remember came in, had a torn rotator cuff, had the surgery and all that kind of stuff. And after he had that surgery, he came to us and he really wanted to try BPC-157 to help with healing, because this gentleman, very active, just a very active lifestyle and everything. And he started his BPC-157 treatment after his surgery. His surgeon was very aware of what we were like, what he was doing, all this stuff. His surgeon encouraged him to do it. His physical therapy, his post-surgery physical therapy was able to be cut in half because of the accelerated healing with the BPC-157 treatment with that and his physical therapy. It was all safely done under the guidance of, like I said, his PT and stuff like that, but it was absolutely insane.
Yeah, no, I have over, I can count over 10 people that I know personally that surgically have had surgery. Obviously, I'm a surgeon too. Bet on BP-157. There's other alternatives too you get on that just have healed at an amazing pace and healed beautifully. And so I think it's something we need to deep dive into.
Yes.
We happen to have our
Let's
peptide.
get that peptide princess.
Peptide princess
The
in here.
peptide princess, Lacey May.
Yep. So before we break, I want to thank our sponsors. I want to thank Rejuvime Medical, Louisiana's largest anti-aging clinic, all throughout the state. We specialize GLP-1s, hormones, peptides. We also do aesthetics.
And Mississippi.
I forgot. Yeah, Miss Gulf Coast.
Mississippi.
We're expanding, getting bigger, growing. And Weiler Plastic Surgery Group, the largest plastic surgery-driven group in the state of Louisiana. We specialize in injectables, all types of surgeries, and we cover the entire southern part of Louisiana. So stay tuned. We'll be right back, guys.
I'm Ashley Shelley. I'm from Baton Rouge, and I've had Sculptra, Botox, and aesthetic procedures at Weiler. I realized that it was time to start taking care of my skin. There were certain concerns that I had, loss of volume in my face and the texture. I knew that I needed to do something about it. Sculptra has boosted my self-esteem and increased my confidence in my skin. I'm 40 years old, and my skin has never looked better than it does now.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I had gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, welcome back. We have got Lacey May here with us. She is our peptide princess.
Yes.
I am.
We're gonna put that on the podcast.
That's a peptide
You
princess.
really are. I mean, people travel. They want your knowledge. You've been, from day one when you joined Rejuvime, you've been pro peptide, which has been amazing.
I'm super. I need to put that on my business card.
Yeah, you did.
Peptide princess.
Peptide princess. No, I think peptides are fantastic. I really got into them, whenever I got into the wellness industry, and just kind of went down the rabbit hole of them, because there's so many that are available. They do different things. They're so interesting.
Right.
I find I would rather, do something that's a little bit more holistic than, like regular, just
Big pharmas.
Yeah. Kind of those things. But they're super fun.
How have you, I don't know, we're going to get into BPC real quick, but how have you seen, because you've been in the industry for a while, the acceptance and of peptides? Has it gone from like just a sideshow to people, like Britt said, hey, I ordered a bunch of peptides, or hey, I want to talk to you about peptides.
Yeah.
Talk about in your career, the evolution of peptides. That make sense?
Yeah, I think people are asking about peptides a lot more now than ever.
Do you think that's because people are starting to see it more?
Well, yeah. I mean, you're seeing a lot of athletes, wellness influencers, even, your Joe Rogans, right? The podcast, they talk about them a lot more. So people are just more well-informed about peptides now. So definitely people are asking about them. It's just so many out there that it's just, highly regulated, which, going to go down my conspiracy hole with that. But people are asking about them. They're a lot more receptive to them. Again, they're kind of thinking about, I don't want to take 5 different prescription pills when, maybe a peptide could help a lot of the issues that I'm having. Yeah.
And I feel too. So Lacey, my peptide princess. So I remember like way back in the day when we only had like 3 peptides, Smorlin, Ipamorlin, Ibutamorin, maybe.
Yeah.
I think like those were the 3 that we had.
Yeah.
And then now, I don't know, we offer like 15 plus.
Yeah.
We have so many more now because I think a lot of like pharmacies are starting to see like, oh, hey, like we should make these. This is good. Yeah. This is good stuff. But because they can be used for such an array of things.
Yeah. I always say it's great, on the outside, but peptides really work a lot on the inside. So it's about making, the inside of your body just as healthy as you want, the outside to be. So no, peptides are super safe in my opinion. I mean, they're almost anybody in the world can take a peptide.
Right.
Can you tell, like on a surface level, kind of like let people know, like what are these peptides that we talk about?
Peptides have been around for, insulin is a peptide.
Yeah.
Okay. So, and now with GLP-1s coming about, those are considered peptides. But peptides are just chains of amino acids that, are in our body that work on different things. So growth hormone levels, obviously we have a whole lot of it when we're young. That's why we're young and beautiful and our metabolism's great and our sleep is wonderful.
Gorgeous.
Yes. And as you get older and your growth hormone levels fall, that's why we age.
Right.
So it's just kind of working that. I can't, make you 20 again, but trying to put the levels back, just like hormone replacement, where the levels could be where they were when you were younger, to get the benefit.
Yeah, and so the way I think of a peptide is, so we have all these receptors in our bodies, right? And we have certain change of amino acids, or we have little transmitters, right, that are floating around our bodies, and they attach to these receptors. And when they engage these receptors, they flip a switch, right? They upregulate things, right? So, like serotonin, or, dopamine. People say they get, the dopamine rush, right? So when you're running and you break through that dopamine high, you're releasing this dopamine, and it latches on to these receptors. And then like the light switch goes on, you get the dopamine rush, right? So in my simple minds, it's a similar thing. So these most peptides are injectable, correct? There are some oral peptides, right? But a lot of peptides are injectable, and so saying like a GLP-1 could be considered a peptide, right? And so they're injected, and they sort of latch on to these receptors, and they sort of do a lot of things that we don't because we don't quite understand. It's hard for physician in medicine to say, we don't know quite exactly what's going on, right?
But it's good.
But it's good, right?
Yeah.
And so, and I think that applies to a lot of peptides because they haven't been crazy studied because they're not big pharma, right?
Yeah.
They've been invented and created at a cellular level in labs, right? So obviously people are doing these things, but they haven't been studied with multi-billion-dollar projects because they're not patented or they're not protected by companies. Does that make sense?
Yeah,
you
like
can't,
it's
because they're already out there,
Yep.
right? And so they're free, right? But to me, tell us so I wrote down some stuff here, right? So BPC-157 does a lot of things, right? But if you look online, it'll say, hey, it does a lot of tissue repair, a lot of repair. So we were talking about
surgeries and stuff like that,
right?
yeah.
It upregulates your gut health, right? Does a lot of anti-inflammatory sort of support, right? People think, hey, it may help your heart. It does something that we call angiogenesis, which is increasing blood supply to various structures of the body. So talk to us a little bit about some of the ways that you think of BPC-157, how you use it, and how you explain it to your patients.
So I'm a huge BPC supporter for anything. Yes, it's very targeted towards recovery for injuries, ligaments, tendons, muscle strains, huge for gut health.
Yep.
That patients that have old injuries, or I'm going in for surgery, kind of finding out what can help them besides pain
and it can be,
management,
I'm obviously a cosmetic surgeon. It can be an elective cosmetic procedure.
Absolutely.
It can be, hey, I tore my Achilles.
Yeah.
I guarantee you a lot of these athletes,
Yes.
are doing peptides.
Yes.
They're doing some growth hormone stimulation. They may be doing growth hormone, but to get that repair.
Absolutely not a blasphemous, Dr. Weiler.
Get that repair, right?
Yeah. So patients that, in the consult process, if they do mention old injuries or recovery issues or something they're struggling with,
pain in a joint in a particular area, or hey, I have an upcoming surgery, or I'm a endurance runner. Not a marathon runner, the triathlon,
the Ironman stuff,
right?
The Ironman stuff,
It's a common thing in the 40s and 50s, right?
Yeah. But even I've had a lot of success with patients that have IBS. Chronic reflux.
Oh, really?
Yeah. I mean, there's some patients that I've been on Prilosec, for 20 years, and I don't have to take Prilosec anymore. So it's been huge on that aspect. But also, too, there's a lot of studies, too, on BPC with nerve function. So a lot of neuropathy, that it supposedly can help with that, even brain fog. It does, I mean, chronic inflammation can cause brain fog. So a lot of times when somebody's on BPC and it has that anti-inflammatory effect, they could have improvement with their mood and their mental clarity. So there's so many different indications that it could help with. But I always do say for the BPC, it's so specific to recovery and so amazing with recovery that that's the best one to do for that,
I do feel like gut health is such gut health is talked about all the time. I feel like gut health has always been such a big topic, and to have something like that, like you said, that can help somebody with IBS or with
leaky gut,
all of that. That's, I mean, once again, the reactive, you can take Prilosec,
right.
or the preventative,
right.
you can take the BPC-157. So it's like,
right.
This is where it's at. Now, BPC, with that, you can take this before surgery as well? Or?
Yeah. I mean, I usually tell people try to do any peptide. It's not an overnight thing.
Yeah.
And this is something that we may want to start you on for a month prior to a surgery if you know you're having a surgery, but definitely around 2 months at least post-surgery. There's no dangers of doing peptides for a prolonged period of time. Some people do, but usually the sooner we can get started on them, the better.
Yeah. I feel like we have patients on peptides that have been on peptides for years.
Right.
I mean,
Years.
if you can be compliant with them, and that's the injectable. Most of them are injectable every day. So that is something you have to fit in your schedule.
I'm just getting to the point where if it's gonna be good, if it's gonna be injectable.
Yeah.
Oh, yeah.
Like once again, our gut's gonna tear up.
Well, I mean, the problem is getting past the gut is difficult, right? It's that first pass. You absorb it, your body processes it. Your body has been designed to protect.
Yeah, it's that first line of defense.
First line of defense. And the protection of oftentimes eliminates the good stuff, right?
Yeah.
And, so injectables is at this point, and it may change in the next few years, but to me is really the best method of delivery, right? And a lot of what we do.
Oh.
So
maybe
I am
there are
not
exceptions.
a pill supporter, and I'll say that all day long.
Right.
Pills, creams, everybody metabolizes and absorbs differently, right? BPC is actually a really good oral option for gut health.
There you go. No,
Very specific for gut health.
But
so
that's what
if you have an injury or something,
if you're targeting gut health,
it's made
you're
from
saying that
gastric
oral.
juices.
Yes. So you're saying that oral is the way to go. But obviously with like injuries and stuff like that, injections.
Injuries, the beauty about BPC, it doesn't have to be injected near the site. You can inject it near the site, but I had a patient actually ask me yesterday, his doctor doesn't want him to put anything near the site, supported the BPC, but you can do it systemically and still get the benefit.
Right.
But if anybody is looking for it specifically for gut health or, the oral option is actually
I love that.
Pretty good.
Well, because I feel like a lot of people, I mean, I feel like you have two types of people. Like me, I don't know, stick me 87 times. I don't care. Like it's fine. I don't mind. That's because we're women and we're strong. But
Is that a jab at me?
This is for women and we're strong. I'm telling you, we got really on our high horse on our girl episode. But some people don't. Some people just
some people are highly averse to needles.
They don't like needles. They
and it's
definitely
daily.
can't.
And it's daily.
And that's the thing. It's a daily
busy.
injection, which I think is very off-putting. Some people are just like, oh, I don't think I can do that.
So let's get a little bit more detailed. Lacey, talk to me about your top 3 indications for it. Or top 5. Talk to me.
Say 3.
So 74 options later. Like,
how much time do y'all have?
do you breathe? There you go. There it is.
I mean, there's just so many different.
Where does surgery lie in those? In that, is that something somebody comes in and says, "Hey,
I think if they know they're going to go into, I mean, obviously that's going to have to be something planned, but absolutely, pre and post. But a lot of times people don't really know until it's until it's after before. But absolutely, pre and post op.
Talk about how do you explain it to your patient and how do you dose it to your patient? Does that make sense?
Yeah. So dosing can be kind of all over the map. Sometimes we could do 200 to 500 micrograms of the injectable daily, or I say at least 5 days a week. Usually night is the best time to inject it. But I just approach it. The best thing to do with any peptide is, one, know why you're taking it, obviously, and to make sure that they understand the dosing, the administration, the duration of time they need to be on a peptide. It's not a 1 or 2 week kind of thing.
Yeah.
But just really getting them to a point that they know what to expect from the peptide. I always like to follow with them about 6 to 8 weeks after starting one, just so we're on track and we know, okay, have you met your goal?
Yep.
But I always say too, it's not even so much about the joint pain. It's not even so much about BPC could just be good for all over health, like I said, with any peptide. But really, if somebody's talking about, my workouts are hindered, or I'm having so many, now these GLP-1s are so popular, right? But I'm having a lot of reflux. I can't tolerate it.
The GLP-1s,
So, I mean, that's a really good indication to put, hey, let's try a peptide in addition. Stacking peptides is never a bad idea. Usually I'll say to stack them, which is really nice. But somebody, it's got to be realistic, and just to make sure that the patient understands, okay, this is the plan. This is what we have to do to get the desired effect and the desired goal. So it's very individualized with any peptide.
I remember like the first time that it was like, oh, you should try a peptide, was I was talking to one of the providers, and it was just, I had started, got real, very confident in myself. And I was like, ooh, let's go to a bar class. I ended up going to like Macy, the body skull bar thing. The next day, I couldn't walk. I couldn't sit down and pee. And they were like, oh, you need to try a peptide. Like, it'll help with that recovery, and you'll be able to recover better and stuff like that. I was like, oh, okay, let's try this out. Like, let's see what happens. And it absolutely, even something as tiny as that. So we're not talking like big surgery or anything like that. Even something like that. Yeah. Because it is kind of like when you've got small kids and you're like so sore and you can't, it's like, maybe anything to get me to the next.
Absolutely.
So it's like, do you ever pulsatile dose it? Do you say, hey, let's do this for 3 months or 6 months?
Yes.
Cycle on and off?
I don't use the word cycle, because cycle to me means, I don't know.
I think that's a bad word, because it's a stigma from like cycling steroids. Right.
Yeah. I usually will, I'm a big encourager of switch your peptide and switch your peptide often. So we may do BPC-157, have a plan. Hey, let's do that for, 2 to 3 months. After that, let's see where we're at. Then we might do a totally different peptide, a testimonial, ipamorelin, or samorlin's a really good one. So I usually say switch your peptides and switch them often, because they work in the same way.
I was about to say, what's your reasoning for the switch?
Change it up on your body. Yeah. They all stimulate.
I think it's so remember, we're hitting receptors, right? So you can, it's like with hormones or testosterone, you can fill the receptors and then you just have excess in your body. So I think that's a good strategy to switch, to get that sort of improvements. Switch to another peptide, which is hitting another receptor, right? And you can always come back, right? In 3 to 6 months. Do you get any sort of, so I always say with samorelin, you get that sort of warm feeling after you inject. You're getting that growth hormone release.
Yes.
Is there any sort of physical manifestation when you're injecting this? I know you said you can also take it orally for gut health, but anything that patients feel, or not really?
Usually, sometimes people can get really flush with it. So after injecting, I always caution them on that. NAD is the same way. I tell everybody, I get so flush with NAD.
PT-141. Same thing.
Yeah. So any peptide can cause that. So I always like to caution them, because they'll call the next day like,
flushing.
I'm in the ER. I thought I was dying.
Thought I had a reaction. I'm allergic to it.
Exactly. Just to make sure they're not freaking out that they're allergic or anything. But yes, they could get very flush. They could get, I would say dizziness to it. I'm not going to say dizzy like, you're unstable, but just kind of a little bit for a second, just kind of, heads kind of.
Yeah. Like maybe you stood up too quickly.
Yeah. Maybe
almost
like that.
Ran a wind sprint. We hadn't been sprinting in a while.
Yes. Some people have said that, but it's crazy, because then some people don't have that at all.
Yeah. It's so specific to the individual.
Yep.
Yes. Orally, not much. Right. So obviously the oral is, going to be a little bit more mild than the injectable, but for the most part, they can say just mild flushing,
Good.
1 to 2 minutes. Other than that.
And expected to feel, or you say, hey, maybe it's working a little bit. If you're doing it orally with gut health, is it a few weeks to see this difference? A few months?
Yeah, no, I would say probably within the first 2 to 4 weeks, you should be able to notice a difference. Injectable, kind of the same way. But that's another reason I say, please don't stop it for a minimum of 8 weeks because it's not.
Don't do it for a week and say it's not working.
That's right.
That's what I
Growth
feel like.
hormones slow to rise.
Everything that we do, everything that we do at Rejuvime Medical, and even you can even go onto the Weiler plastic surgery side when we talk about
no, it's like surgery, right?
Aesthetics.
You do breast implants the next day, they don't look good.
They don't. It's like
it takes some time.
We live in such a an instant gratification, an instant gratification society, and it's just like wait, just give it, give it time. Let it work. Like, it's going to take your body a second. Your body's not going to be like, oh, yep, now we're here. Like, and we have this I think like realistic expectations with patients. Like, hey, listen.
Yes. Which is why it's so important to
educate
sit with a knowledgeable provider. If somebody is sitting in front of you saying a peptide's going to change your world overnight, that's completely false.
Right.
That is not going to happen. And we got to remember too, there's many different things that go into how we feel besides our growth hormone.
Yeah.
If you have a guy that comes in that has low testosterone and he thinks a peptide's going to be the end all be all, well,
not going to cut it.
there's a whole new different conversation to have. But having realistic expectations, because if they don't and they're not told that, they're going to quit.
Right.
Yeah. And then you don't get to see how great it could have been.
Right. It's like you're not giving it a chance.
When we talk about injectables and stuff like this is just like a subcutaneous injection. Like you said earlier, I always say when I talk to patients about it, I'm like, think insulin syringe, like very tiny needle, very skinny, just little bitty, and these are just like little sub-Q injections that you can do every night.
You could close your eyes and do it.
Absolutely.
You cannot hurt yourself. Yeah. It's just going right there in the fat. Again, doesn't have to be near any certain site. It can go anywhere on your body, which is nice. But yeah, it's super small. Just get into a routine with any peptide that you do. It is something that you're going to have to do daily for a few months. And then again, we kind of reevaluate, okay, what other peptide do we need to put, to kind of keep the benefits going.
And this is kind of like more, this is not maybe, necessarily BPC related, but like in general, what do you find to be the misconceptions regarding peptides when people, because like you said, because I think it's because it's not regulated, because things like that. I think people have like two different opinions on it. It's either like I was saying, my friend who texted me this morning was like, "Oh, I'm coming to see y'all because I want peptides." Like, and he is an ex-athlete.
Yep.
He is very knowledgeable about like health and stuff like that. So I do understand like him being. But when you go and tell somebody like, "Hey, no, I've been taking BPC-157, blah, blah, blah," where do you find that the doubt comes in, if you will?
Or the fear. I always call it the fear.
The fear.
Fear, my gosh.
When you get a pushback from a patient, what is it usually? Does that make sense?
If I get pushback, it's not FDA regulated, or which, the side effects of some of the medicines that we take on a daily basis is quite frightening.
Yes.
Yeah.
And the fact that, peptides, I think it's, lack of studies is but also too, if we're changing the world with peptides, do with that as you will. But I just feel that a lot of people will, the lack of studies, the, lack of human studies, should I say, they're not doing that. But it's not, most patients, these peptides have been out for a long time. I know that they just haven't done the human studies on some of them. And I think that's what gives a lot of people pushback. But it is extremely rare. I've never seen it where somebody has had a bad reaction from a peptide.
Right.
I feel like any reaction, most of the time when we talk about peptides and things like this, it's not necessarily related to the peptide. It may be the vehicle that the peptide's in that they have more of a reaction to. If you even go on the hormone side, take testosterone, for example. We have grapeseed oil. Okay. you're not allergic to testosterone.
Right.
You're allergic to the grapeseed oil.
Right.
Or you're allergic to the preservative that's in whatever thing. So it's not necessarily that, that's what's causing the reaction. But I do feel like people, once again, we could just do a whole show about conspiracy theories. I do think that people hold on to FDA approval so hard sometimes that it's like,
I think I don't think people understand, and I'm on the FDA, what it is. It's very shady because a lot of these, so I'm in the aesthetics world, so plastic surgery world, and a lot of these devices come out and they say they're FDA approved. Okay. They're not FDA approved what they're telling you they do. So there's a lot of skin tightening devices out there, right? And so, your rep will come to you and say, oh, this is a great new device. It's FDA approved. And it does skin tightening. Okay. So the general public thinks it's FDA approved for skin tightening. No.
Yes.
If you ask them, what is it FDA approved for? Skin heating.
Yeah.
But it does skin tightening.
Yeah.
And so there's a lot of, you see these commercials, there's a lot of FDA approved things that, and the majority, a lot of times in real, I call it, sort of big medicine, right? We use medicine for the side effects. We use them off label, right? And so, I firmly believe peptides are very safe. Okay.
Yes.
Are they, does everybody get the results that we tout or the reasons we use them? No. No. They are, some people will live and die by BPC-157.
Yep.
And for some people, it really is a absolute life changer, right? And then there's other patients that are like, it was
all right.
It was all right, right? And so, I think when you look at a peptide, so I wouldn't sit up here and talk if I didn't think they were safe. So I do think they're safe. There's just so much about the body that we don't understand, right? And these medications are created to hit certain receptors. And we are finding out about receptors on a weekly basis, right?
Every day.
Think about how long it took us to develop GLP-1s.
Yeah.
And the weight loss market.
It was not.
It's huge.
But that's, once again,
think about.
It was not FDA approved for weight loss.
It was not.
Yeah.
Viagra was not created nor approved for erectile dysfunction.
Yeah.
That was a side effect
Yeah.
of the medications. The holy grail is going to be when we develop a peptide or a medicine that grows hair, and it's coming, but it will be here. So, I think that, but it probably won't work for everybody, So these medications, especially focusing on, I think BPC-157 is a wonderful peptide. I think it can be transformative for recovery of procedures, injuries. I think that the anti-inflammatory effects are amazing, right? And I think, I think the FDA does some good, but I think it also does some disservice also. So, there's certainly, we have to make sure medications are safe.
Yes.
But I also think that people hide behind FDA approvals, or they use it as a weapon.
Yeah.
And big pharma.
Well,
does,
it helps
it
helps what I want to say, like the fear. It helps you're looking for reassurance.
It gives you a
that
stamp
you're
of
fear.
approval,
Yeah.
but oftentimes that stamp of approval is not what you're using it for. Does that make sense?
Yes.
And it can be very deceptive to the general public, and that's kind of what I'm getting at.
I was about to say, I know Lacey May has put a decent amount of off-label Botox into my face. But no, and I mean, this is why I think, compounding pharmacies and everything are so vital.
Yeah.
Because
it's the future. It really is. It's there's a huge battle between compounding pharmacies and big pharma going on right now.
Yeah.
And obviously there's a lot of money involved, but I think these peptides, these compounding pharmacies, it's really a win for the little man, in my opinion. And, I know we got to close out a little bit, but I personally love BPC-157. I have seen some dramatic effects as being a surgeon in terms of the recovery addition and potential. I think it's extraordinary. I really do.
Well, I have a question about that. Do you ever suggest it to patients?
And I'll be honest with you, I highly encourage it when patients ask about it, but it's not something that I routinely have in my suggestion sort of preparation for surgery. Just because I don't want to mix my apples and oranges.
Yeah.
And I don't want to, I come at it. They're coming to me as I obviously have lots of different careers, but they come to me as the expert in their plastic surgery, and I don't want to focus on that. If they ask me, or if they ask my staff, absolutely. We do have patients that come over and get on it, but it's not something that I routinely recommend. Now, if I was an orthopedic surgeon, I probably would, because it's a little bit of a different model.
And I'm seeing a lot of that. I'm having a lot of sports medicine and orthopedics in the New Orleans area that actually will support it. So that's been really interesting. And that's been probably new over the last year.
Yeah, I think it has. And I think some of this has to do with the movement that you're a part of. And the sort of, education movement of peptides, the acceptance of peptides, and the understanding that, it doesn't have to come from Novo Nordisk for it to work, right?
Yeah.
And if I was an orthopedic surgeon and I'm doing hip replacements, which is not, they're elective, but semi-elective, or if I'm doing trauma surgery, or if I'm doing, someone, grandma breaks her hip. I am saying, hey, if you want to do everything and you want to do rehab, you want to do, my surgeries don't get into that kind of stuff, but you need to do rehab, and you need to go find the Peptide Princess. And you need a BPC-157 to really get you back there. And I guarantee you, in the sports medicine world, like you said, and I think this is trickling down from our elite athletes who had the understanding or were being told about this. And maybe we'll get your husband on, or some of these ex-players in here to talk about their secrets years afterwards. But, I always and I don't know Peyton Manning personally, and I think he's a great guy, but I guarantee you that with his neck, I don't know if y'all remember, he had severe neck issues, that hardware wouldn't grow into his bone. There was some exploration of these types of legitimate alternative therapies to get those things to work.
Well, and that's like the greatest thing. So I think it's access. So like when you say that, all these like the athletes from the sports medicine world of things, it's the access. It's the person that's saying like, hey, listen, you're going with this. Look, this is what I have. I think this can work for you, blah, blah, blah. And having that access. And then once that person has that access to, because there's probably not a place, like I do still feel like, because peptides are so on the forefront and everything like that they're not everywhere, No,
they're not. And I think that's trickling down, like, it was, and I'll be transparent, these pitchers that were having these joint issues and all, they were getting injected with a combination of fat, and growth hormones and some peptides. And that was highly controversial. That was being done, across the pond. And they were coming back. And so, but they were getting legitimate recoveries. And so these professional athletes that were being given these therapies are now rolling down to our high school athletes and to our college athletes, and then into our weekend warriors. And so, this is all good stuff. And it's an amazing, surgery has to fix broken things, but these types of medicines can also help your body repair.
Support and
repair.
And be preventative.
Yes.
Like I said, the better the inside, the stronger
the gut
you
health,
are. That's right.
The anti-inflammatory stuff. If you're a weekend warrior and you're 9 to 5 in it, Monday through Friday, and you're hitting Saturday, you're doing 2 miles in the water. Was it like a 90-mile bike ride and a 20-mile run?
This is where it's at.
That's it.
All right, Lace. So being the peptide princess that you are, and being on the forefront of this, and I know how much you love this and how passionate you are about this, what is, and we can kind of leave on this note, but what is most exciting for you as somebody who prescribes, sees the results and all that jazz, for this turn of thinking that is happening around the world of peptides?
I'm just excited for like the off the beaten path, like thinking about more off-label, honestly preventative type medicine. And I think as these peptides start to get bigger and bigger and people talk about them more, that we're making more room for that type of medicine, wellness medicine, rather than be reactive with more big pharma. Right. So it is super exciting. People are talking about it more. We're getting a lot of really fantastic results with it. And I'm just hoping it's kind of the future, right? That we're really just opening up a door. And then, by the time that 40 years down the road, we're going to have a peptide for everything.
I can't wait.
Right.
Yeah.
I know.
I can't wait.
I know. Wild.
I'm like all the peptides. Everybody needs peptide.
Yeah.
We can quote that under my Peptide Princess. Everybody needs a peptide.
You get a peptide. That's like your business cards, Peptide Princess. Everyone needs. And so that's something that we really didn't touch on. We're going to throw this in as the last sentence of the thing. Everyone can have a peptide.
Everyone can have a
peptide. You don't need, everybody can have a peptide. Peptides for everyone.
Peptides for everyone. Absolutely.
I love that. Yeah. So, well, Lacey, thank you so much.
I'm so happy
Thank
to be
you so
here.
much.
Yes.
So
We love having you.
I know.
Don't worry. We have like 17 other peptides to work through.
Yes.
So
Call me back. I'm ready.
And then the next time we kick Dr. Weiler out, we'll do the girl episode on PT-141. Ladies, stay tuned. No, but thank you so much for coming. Thank you for taking the time and
Thank you for
educating
having me.
and all that. Remember to like, subscribe, follow us on
Hit the
YouTube.
button below.
Listen to all of our stuff on all the platforms and everything. And always remember to consult before you cut. We'll see you guys next week.
Thanks, guys.
Bye.